afternoon. So I hope you're prepared for a little change of pace because this isn't basically a scientific presentation. Sari asked me to talk about my personal journey, and I said, again? And she said yes, that in Israel it hadn't been heard and that it was worthwhile. So I hope you find it so. I was a successful entrepreneur in the financial industry. And at 44, I suddenly became extraordinarily ill. It was a gradual process over the course of a year. I was an investment banker at that time, and I had founded my own small syndication company that specialized in financing nonprofit developed low-income housing tax credit deals. It was the first housing program in the US that worked. And we got to do a lot of exciting things. I loved what I did. We provided low-income housing to the working poor. And it was very high quality. It was an intellectual life that I adored, and it fell apart when I was 44. It took 10 years before any diagnosis came forward that was sustainable. And I later found that that's often the case in the disease that I had, which was ankylosing spondylitis. It was complicated by other damage from heavy travel, heavy cell phone use, et cetera, et cetera. So it took a while before finally that diagnosis could emerge. And the day I met with the brilliant rheumatologist who diagnosed me, he said, "You have something pretty rare and you have something much more severe, but by the end of the day, I think we'll know." So he ended my questioning at 10 years, and we rapidly moved through the typical drugs that are used in the rheumatological space. We tried all of them. I went through injecting methotrexate into my stomach and doing various things and being sick, as a dog the day you do it every week. We then moved on to the biologics. And, those are wonderful, miraculous drugs for most the people that use them. But they're also incredibly potent and somewhat dangerous when applied as they were in my case, which was I went on every single one of them, one after the other. So I would experience miraculous results, and then I would have devastating side effects. So the last one I took was Humira, and I injected it twice. And I went into about the worst experience I'd had in my life, even worse than the chronic disease that I'd been experiencing. My docs weren't sure that I would live for 6 years. I lost I weighed 20 pounds less than I do now. Body percent of fat was at 15%. So anyway, that was a journey that I wasn't too happy to be on, and it wasn't the one I had been looking for from treatment. So friends kept insisting that I consider cannabis, and it was legal in California medicinally since 1996. But I had this feeling that that was a bunch of nonsense, and wink, wink, nudge, nudge, medical marijuana was really an excuse for people to get high. I didn't have a problem with people getting high, but I thought they should be honest about it. And it wasn't something I wanted to incorporate into my daily life. So the stigma was a real problem for me, and finally I turned around and said, okay, I'm going to try this. And luckily enough, I lived in the world where Harborside existed, and I was treated with dignity when I went there, unlike other experiences in dispensaries. But it wasn't a world that I was used to, that I knew, or that I wanted to be part of. And I had been a health freak since I was 18. I had eaten only organically. I knew the source of my food, and luckily in Northern California, that was possible. I was a slow food locavore, and to walk into a dispensary and to buy something that I couldn't know where it was grown, I couldn't know the name of the person, I couldn't even know where, and it certainly wasn't going to be grown organically in those days. So that started my journey. And my journey specifically started in my wine cellar, where I took about 100 cases of Rhone wine out, and I put in 2 4x4 trays of cannabis, and I started to get my life back. It was an amazing, amazing journey for someone as physically impaired as I was. but I could do it on my own time. It was a secret, though legal, endeavor. And so if I was awake at 3 a.m., I could work with my plants at 3 a.m. And it did a lot to bring back life in a really isolated, painful, ridden existence that I had. So what happened is that I turned out to be very good at it. And I got much, much better incrementally. At first, from smoking the cannabis in a vaporizer, I would experience incremental relief. I found that I didn't want to be high, and I had to really work against my prejudice about doing that on a daily basis. It probably took me about 1.5 years before I got over that. So I realized this is a pretty short talk, so I want to try to speed ahead a little, and I don't want this to be an advertisement for my company, but what's happened is that my company has taken over my life. And so what specifically happened is that the famous doctors I was working with said, "How come you're better? All the cutting edge stuff we were doing isn't working." And I literally shook and told them what I was doing. And they said, "Well, everyone here needs that." Instead of sending me to the police, they actually thought people should use it. So after a few months, they sent me a couple of glioblastoma patients, and they gave them a recommendation, which is what you get in California to be legal. And one of them had 6 weeks to live, and he had a paralyzed left arm. And we said, why not try? We'd heard the stories. I had no idea really if they were true or not, but at that point there wasn't much to risk. So rather miraculously, in 3 weeks, he regained use of his left arm. So they rushed him in for an MRI and found that the tumor was 60% less. And in 7 weeks, he was declared cancer-free by his doctor, or at least the disease process had stopped. So then the second fellow, he had convinced a dispensary in California to make him a very crude version of Rick Simpson oil. And he credited it with his being alive. He was never supposed to be cancer-free. He had a big, huge divot out of the side of his head and walked, erratically. So he was an attorney, he was famous, he'd sued all the cell phone companies in the US and Canada for what he called suppression of evidence around glio. So he started writing me texts at 3 a.m. He started saying things like, "You're an effing genius. I want to go into business with you. My symptoms are so much better in 2 weeks." So what that did for me personally is it said there is really truly something to this. It scared me a lot. Honestly, it was a big burden, and it was also a really, really exciting, wonderful thing to be part of. So we went through the story that I told a little bit of yesterday, where that we standardize what we do, we control the genetics. We basically met the objections I had to the current delivery system in California at that time. And then they wrote a story, and they couldn't find anyone in extraction that was willing to talk about it openly. And I had had enough kind of notoriety from this famous oncologist who started sending me all these patients, and he started talking about stage 4 second occurrence patients living that he didn't expect to live. And so he started talking enough that I was being inundated, and I was really fearful. I thought, am I going to go from a problem with the DEA to a problem with the FDA? I'm not making claims about this, but other people are. And I decided that maybe publicity was the best thing for me. So I agreed and thought we'd have a little tiny story on the back page, and it turned out to be a cover story, SF Weekly, called The Miracle of Cannabis Oil. And I started literally getting 200 phone calls a day on my cell phone and 150 emails from around the world. So people got angry because I couldn't call them all back. And I had been trained as a young, I started off life as a psychologist, and before I went into business, and I had worked for 7 years as a clinician, and I was dealing mainly with older, very sick people who had never touched cannabis. And their oncologists said, go to California and do this. So we devised kind of a coaching model that helped hold them. And after about 7 months of being inundated and not taking a single day off, I mean, talk about my life changing. I'd been housebound, invalid, and now all I do is work. I said something has to shift. This isn't sustainable. And so Christmas of 2013, I made a decision to try to protect the IP. We do patents. It's a journey, and I think it's a journey that probably a lot of you would have been interested in at that time because it was almost impossible to do it. I applied for a trademark in California and was told politely by the state office that if I persisted in this behavior, I wouldn't like the result. My attorneys were surprised. We thought we could get trademark protection in the state. We couldn't. But we ended up getting patents, international patents. I have 2 of them issued now and 1 more pending. And we've done a good job of standardizing and caring about what we do. And it certainly has impacted me and my life in a way. I was very afraid about how cannabis might change me. And in fact, it changed me much more than I expected, but in very different ways. I think it's made me a much nicer person, honestly. It's given me affinity to people that I didn't have before. It's reduced my fear about social stuff. And it's been such an improbable journey that in many ways it's turned my logical, rational brain, it's surprised me into a shock of being open. So I think if any of you have any questions, a lot of people have asked me. I think maybe if we have a few minutes, that might be the best way to spend our next few minutes, if there are.
Question, do you still work primarily with Rick Simpson oil? Or?
Well, the first time I met Rick Simpson, he screamed at me that CBD kills people. And I understood his concern that if you turn towards CBD only and ignore THC, you are not dealing correctly with the plant. Rick Simpson now, his organization now uses our ratio that we pioneered. He hasn't thanked me for that. I've changed my mind a lot about, I think he's a very brave person, but his process is highly toxic. And when I looked at what he had done, I was very, very grateful that he brought attention to this. But I had autoimmune, very serious, and I hoped to live way beyond most cancer patients' expectancy. And I felt that for sure his process would kill me if I took it daily. So that was a very important part of what we had to do. He used naphtha. He used naphtha jet fuel as his solvent. And I just had a paper that I got to read before publication from Arno Hazekamp and Luigi Romano, who now works with me in my lab in California. And they prove that naphtha actually is a stickier solvent than almost anything, and you can't really get it off. So I made the right decision going for organic ethanol, and luckily I could do so. We've standardized what we do. We work with known genetics. I think we are so far past Rick Simpson oil that I kind of wish that term would die.
I just have a question as to what you standardized. Like, what does that mean for you and your company?
Yeah, and that's also, it's a work in progress, honestly, in the gray area of California legality. So when we tried, for instance, to work with blood levels, we couldn't, because we couldn't get anybody to test the blood levels, right? So what we did is we said known genetics. We work with the genetics that we work with, that we had that results with, and we standardized by weight our process so that we know which strains we're putting in, which group of strains, all that sort of thing. And we have written SOPs through ISO 9000 pharmaceutical standards for what we do so that training is more replicable and scalable. I am underway with certain chemical engineering consultants to look at a more objective process of what we do. I think there's good and bad in that. We are artisanal small batch, and we must scale up. And so we are dealing with those issues. But when I said standardization in the beginning, What I meant is if you come to us and you find something helpful, because lots of doctors sent Lyme patients and all kinds of amazing people to us who needed help, and it was really experimental. So we said, if you find something that helps, we can do it again exactly the same, from the same grower, from the same genetics, to the exact same measurements by weight, so that you could find a reliability in approaching what we do.